Hi, welcome back to the BTC How-To series for the Sim Lab. We have a helper today. This is Connor. This is my son. He is just pretending to be a patient so that I can show you how we navigate working with real live actors in the Sim Lab. So when you come to Sim Lab and you see a real person in the bed, you should assume that is your patient, but you always want to make sure that you ask for their name and their date of birth. Connor doesn't have a name band on his wrist, but I'm still going to ask him his name and date of birth. What's your name?
Connor.
What's your birthday?
February.
February. Good. All right. So that's good. And then when we're going to do assessments and stuff like that, you're going to go through the motions of doing your assessments. So if I was going to do a temperature, I would just say, I'm doing the patient's temperature, can I get the value? And the sim staff will tell you. And then blood pressure, you can put it on them. I'm just gonna put this on you. And then you'll say, can I please have the patient's blood pressure? For blood glucose, all you have to do is just take the pack out of the assessment cart here and say, I'd like to get the patient's blood glucose, and then the sim staff will give it to you. And then for pulse ox, you'll ask the patient, can you put your finger in there please so I can check your oxygen? All right. And then you'll ask, can I have the patient's oxygen saturation? And then the sim staff will give it to you. Okay? So that is how you're going to navigate your assessment values with an actor. Now, when it comes to lung sounds and whatnot, when you're physically touching the actor, the patient or the actor will be wearing a t-shirt that will be underneath the gown. So if Connor had a patient gown on, this shirt here that he's wearing would be his skin shirt. So we want you to listen over the t-shirt on the actor, which will also be under a hospital gown. So you're basically just going to say to the patient, I'm going to listen to your heart. Okay, and now I'm going to listen to your lungs. Breathe. Good. Breathe. Good. Can you lean forward so I can listen to the back? Thank you. Breathe. Breathe. Good. Okay, and so that is how you're going to listen to the actor for lung sounds and heart tones. Now, there may be a time where your actor will be wearing this. This is a task trainer simulator that basically sits on the patient or on the actor. Connor, can you sit back? It just sits like this. Can you move your hands? This is an adult one. So it sits on the actor like this, and then it's plugged in and it's running. And the actual lung sounds, you'll actually be able to hear different lung sounds in different areas of the chest. There is a front and a back. It gets kind of warm for the actor, so he usually only wears the front. So when you're assessing lung sounds, we only want you to listen to this if you see this on the patient. Obviously, I cannot make my actors have crackles or wheezing if they have healthy lungs. So that is how we use these to simulate that for you. And so there aren't any different heart rates in here. So if you have to get an actual heart rate and tone on a patient, you'll actually get it on the actor over their t-shirt. Okay, so that is how you use this. When it comes to assessing an actor, like let's say Connor had a leg wound or something like that, there may be like some fake skin here with some moulage, basically fancy word for theatrical makeup, that makes it look like it's infected or something like that. We want you to assess that area as if you would in a real situation with a real patient. If I wanted to ask the patient questions, I could say something like, Connor, are you having any pain today? No? Okay. And you see that scale over there? It says pain assessment from 0 to 10. What color do you think you are today?
3.
For pain? You're a 3.
I'm 6.
Oh, you're a 6. You're in pain. You're in a little bit of pain today? Okay, so he's giving me a 6 for pain on the little faces. And that you can use the assessment tools with your actor so that they can come up with the appropriate answer. We do want you to wear gloves when it's appropriate. So if you're assessing a wound or you're doing a culture or something like that, obviously you would have gloves on when you're working with the patient. Generally, we tell you to wear gloves at all times with the simulators. If you have to give meds to the patient, basically you'll do your 2 med checks over by the mirror, and then you'll do your 3rd med check over here. We don't ever put anything in the simulator's mouth. Same thing applies for an actor. So they basically will just pretend. You'll put their meds, their bags in a little med cup. You'll hand it to the patient and they'll go boop, and they'll say, okay, I took it. And then you'll assume that the patient has taken the medication. If there is an IV or some sort of equipment connected to the actor, generally there will be a receiving bag for fluids. So when we hook up an IV to an actor, it looks like a real IV, but then on the bottom of it, it's connected to like a reservoir bag, so that we can actually push fluids through the fake IV, and those fluids will go into a reservoir bag. All the reservoir bags say not in play drain bag, so that way you know that that is not an extra, catheter or something like that that you need to assess. It's just receiving the fluids that we are simulating with the actor. If you need to have the actor move or get up or anything like that, they can do that within reason if it is applicable to the simulation. Can you think of anything else? The patient may ask you questions. The actor has a specific role that they have to follow. So they also may be wearing an earpiece. So that is so that I can communicate with them from behind the control room mirror. So that way they might not be able to pick up other things that are going on in the room. So I might be telling them to say things or do things or to cue you to kind of get you to see something that you're missing or something like that. I think that is it for now. Stay tuned for more how-to videos for BTC SimLab.